my mum had a childhood incident where she had a burn by, I believe it was a family member. She was very young. She had a burn. She had a systemic infection, so an infection that went all the way around her body. And my grandmother was told that her development was very likely going to be slow. So when she came back to the UK as an adult, and then she had me and my brother and sister, some of those things then started to show in how she wasn't really able to care for us in that way. And I would say I became the carer, what I now know to be a child carer. Nobody knew. But my community, my estate, I always say, and my mum agrees, I said that if social services knew what was going on in her house, we wouldn't be there anymore.
Definitely.
But that community, that estate, that, sometimes a lot of people frown upon, they kept us.
Wow.
They looked after us. So I'm turning that pain into saying, both for my mum, the years that she has left, she should finally feel like people get her and they understand that she's not doing this on purpose. It's for other children who have been child carers and have had to carry that burden and now are now trying to have their own families. We've carried that trauma with them.
Through voices strong, stories told, connections formed, we find our place, echoes of our community.
Hello, welcome back to Echoes of Our Community. My name is Margaret Taribo and I'm your host. Now, on previous podcasts, we've been talking to moms about their experience with maternal health and the inequalities and their feelings of not being listened to. And on those podcasts, we had a wonderful woman, mother and wife that was part of that journey. And today we have her back here again to talk about her journey, her life, and her role in that sense. On those podcasts, she was looking at her role as more of supportive, but today we're going to be looking at what does it mean for you, Buki, in terms of your role, in terms of why do you do what you do? Who are you? Where did your journey start from? And then where are you right now? So it'll be interesting to hear. So if you haven't already, please go back and watch those podcasts. They're powerful, with powerful moms sharing their story, making themselves very vulnerable. And today we're hearing another story. So welcome to Bukola Adegoke. So who are you, Buki, once again? Do you want to, and your role, yes. Why do you feel, why are you qualified to do what you do? Yeah.
So my name is Bukola Adegoke. I am a midwife and a health visitor and a public health specialist. Also a wife, mum of 3, eldest child, grandchild, and just have I would say it's a purpose to impact on our community and really reduce. I mean, in my mind, inequalities can be eradicated. We can do it.
We can, yeah.
So that's my purpose.
Wow.
Yeah.
So what's your journey been so far in terms of your experiences with maternal health and having children?
Yes. So I was born and raised in the UK. Went back to Nigeria when I was 1. Lived with my grandmother and grandfather and uncles for about 6 years. I came back to the UK when I was 7 or so. Lived in an inner London borough that has meant that I've kind of seen a lot of things. But just grateful to God that I was able to come through all of that, some really challenging times. And I think for me, it always goes back to that culture that I was brought up in. I had the opportunity to go back to Nigeria and was really nurtured, I would say, had the best of everything in that time. And I believe that what that instilled in me was just this leadership mentality. So came when I was back in the UK, as I said, really faced some struggles, things that I couldn't really understand when I was that age. And I know it's something that you speak a lot on your podcast about, families, intergenerational. Yeah. Me and my mum had this thing when I was young, because I couldn't understand. There was a lot of things I couldn't understand. But actually, once I started becoming my journey to become a professional, so I'd always wanted to become a midwife, funnily enough, when I was like in primary school, secondary school. But when I started to study more, I started to understand the reasons why my mum had so many challenges. So my mum had a childhood incident where she had a burn by, I believe it was a family member. She was very young. She had a burn. She had a systemic infection, so an infection that went all the way around her body. And she was born in the UK as well. So she was isolated because the infection was so bad. And my grandmother was told that her development was very likely going to be slow. But being African, I think sometimes my grandmother must have forgotten. So when she came back to the UK as an adult, and then she had me and my brother and sister, some of those things then started to show in how she wasn't really able to care for us in that way. And I would say I became the carer, what I now know to be a child carer. But I didn't understand why it felt like things were so difficult. Why was I so different? Why did I carry having to look after my younger brother and sister and do everything for them? Why was essentially I was the one who was carrying the home, but nobody at school, nobody knew. But my community, my estate, I always say, and my mum agrees, I said that if social services knew what was going on in our house, we wouldn't be there anymore.
Definitely.
But that community, that estate, that, sometimes a lot of people frown upon, they kept us.
Wow.
They looked after us. And we had people from all different walks of life. So if I'm honest, I didn't know what racism was for a long time. Because my next door neighbour was absolutely amazing. And he was a Caucasian man. Looked after us. If my mom wasn't around and needed help, he was there. So it wasn't until I became a midwife, became a health visitor, that I started to think, oh my goodness, this is what I've been going through. And better still, this is what my mum has been going through.
Wow.
And it was then through that I started to unpick and uncover exactly what was going on, to the point that we are now on a journey to get a diagnosis for my mum.
That is so strange at her age to want to do that. And that you can imagine so many of our families, our moms, our grandparents. In fact, I did a session once and then we found out that because the parents didn't know what their daughter was going through. I think she's 21 now. They just found out that she's been diagnosed with autism, but they don't know where to go from there. She's just 21. She doesn't have a job, but they didn't know. But it's so, but for your mom, for you wanted to go on that journey, it just shows the level of empathy that you have as well, and your willingness to want to dig into that.
Yes.
Because some children could have said...
Well, it could have easily gone that way. Yeah. But I will say that the line of career, and I think just who I am,
I think so,
really made me think, actually, this is what she's been going through. And it wasn't her fault. When I think about the reason why this has happened to her, it was because of basically trauma, injury to her body and her brain. But people will just look at her and think, oh, she's slow. Oh, like in our community, unfortunately, people really look down on people.
They do. We're quick to judge or patronize and say, that you can't do this because you're this. And it's so easy. And unfortunately, because we don't tell these stories, our children don't know that. It's a good thing that you know that story. A lot of our children, because of the shame, the stigma, will hide that away. And then children feel, well, you didn't tell me. And therefore, the way they relate to their parents, it's quite, it becomes unhealthy.
It's very unhealthy. And I think for me, I was blessed enough that my grandmother, she's 85. So she's still around and she's been in the UK. So I was able to, when the situation happened, a crisis happened, that I was just like, I can't take this anymore. I said, I'm digging up everything and I'm letting everybody that needs to know knows that. So this woman at the age of over 60 can finally get help.
Fantastic. And how's that so far? How's that looking?
It's been hard because, believe it or not, there isn't pathway per se for an adult to be diagnosed
Yes.
with a learning disability difficulty. I mean, you've got the dyslexias when you go to university, and that even that is getting better.
Yeah.
But really, someone who's just had struggles, maybe has been behind with their rent, you can see that there's something. You know, we always say that most of the times people know that there's something.
But you can't really put your
But you don't know,
finger on
like,
it.
what is
Yes.
it? So going through that process, having years and years of referring to social care, social services for it to be said, she doesn't meet the threshold, she doesn't meet the threshold. Even in crisis situations.
And that's what we hear all the time. You're not, with whether it's children or adults, you're not reaching the threshold, and therefore, and then people get lost.
And if you don't have someone like me to advocate and say, actually, no.
Wow.
We've struggled as a family. I've firsthand been the one who's had to, I would say, suffer. Let's put it like that. Because of everything, my mum has had quite a lot. She's been quite vulnerable. I'm going to put it like that. Because I know if she was someone that I was looking after, I know how I would feel about it.
Yes.
So, but as the oldest child, I was the one who I believe has had to suffer the most. So I'm turning that pain into saying, both for my mum, the years that she has left, she should finally feel like people get her and they understand that she's not doing this on purpose, but actually she's having genuine struggles. But for other people in our community as well, who are facing this, for other children who have been child carers and have had to carry that burden and now are now trying to have their own families with carrying that trauma with them.
And what makes it much more difficult is the fact that they have the learning difficulties, they have the different struggles, they have the mental health issues,
Yes.
and then they have another layer of racism
Yes.
as well, systemic racism.
Yeah, yeah.
So there are different layers that we have to keep on unpicking.
Unpicking, yeah.
Well done to you, Buki.
Thank you.
And so how's that? So now you're still at that. So that's one level of your journey.
That's one level of my journey. Second level of my journey, as I said, and I think it's all wrapped up in each other, that desire to want to help, to have always been the one that has helped. Then went into midwifery, as I said, went into health visiting very quickly and just started to see the inequalities more and more. I believe I'd always worked in areas where I could help my community, which I think was really beautiful, but also worked in, central London. And it's always kind of been the same thing of just never feeling like anything is too much. If someone needs you at that time, you do all that you can to help them. And you can go to bed with a clear heart.
Yes.
And know that I did my utmost best for you. And actually, I always say, once you care for women are not difficult to care for once you're kind to them.
Have you ever felt frustrated? Because sometimes you want to care, you've got that heart that you want to give and everything. Have you ever felt it being thrown back in your face? Maybe because of the traumas that these families or parents, mothers have gone through, but because of their trauma, they just resist you. Have you ever felt that frustration or that? How have you felt with that?
I think I've felt frustrated at the system. But the mothers, I give them time. Because you have to understand, especially when you've been let down over and over again, what's to say that you coming into their life is going to be different?
Exactly.
So I give them time and I show them that I care and we build the trust. It takes time.
It does.
It might take month after month after month, but you know what? Eventually they will see that you're on their side. And that matters. You have to win. It may take time, but we need to give them the time because they're people and they've been let down and this is their journey. So I can't really say that I really get frustrated with the people that I care for.
But the system.
It's the system that frustrates me, yeah.
And you know what the system doesn't have? Time.
Yeah, well, that's true.
Because it's funding, isn't it? They will tell you that it's not a priority. So, and we know that our communities are struggling with trust.
Yes.
So if we have more people like you and I that can give them that time, how powerful do you think that will be?
Most definitely. Effectiveness.
Yes.
And prevention.
Yes.
Get into families before.
I was at a session with Parent Action 2 weeks. No, was it last week actually? And we were promoting one of the programs, and one of the parents said, But why do we have to wait until that child is a teenager?
Yes.
Why can't we do what we need to do before then?
Yes.
Why? I'm going to throw that
Yes,
open to you.
yes.
Why do you think prevention is a problem for our systems? Why can't we work on the prevention? Why must we be very reactive? Well, until somebody dies.
Yes.
Until a situation happens.
Yes, yes.
Why is that? Do you have an answer?
I just feel like it's not built in to the system. We are very reactive. We are very, like, what we see now, that's what we deal with. Whereas the treatment and the prevention should sit side by side. If we always make sure that for everyone that we treat, we also prevent. Because we won't see, and actually I think sometimes the prevention takes, you have to invest in the prevention.
Yes.
Without often seeing the results until much later. So I was talking about the reason why I went into public health. I went into public health because actually if public health works, you don't know. You just see that thing that was going to happen did not happen because you intervened. So sometimes people say, what is that? What is it anyway? What is public health? You don't actually know because it's working. It's when it now starts when it gets removed. So take health visiting, for example.
You were a health visitor?
I was a health visitor as well, and I went into it because I wanted to prevent. But actually, the move and the shift that health visiting has taken now, and even speaking to my peers who are health visitors, they are focusing a lot more on safeguarding. And what is that? That is us treating and reacting. We've taken away the prevention element of it that will stop all of those things that we are now seeing, all the developmental delay, all of those things where we should have really started. And for me, it does start at preconception. And we could go back to preconception actually in colleges, in schools, in universities.
Yes.
So if we could put investment, and I'm sure there are countries that do it.
Yes.
That they see the value, sometimes even see the value of prevention even more than treatment, because you will never see treatment come down until your prevention goes up. So I think that's what we've been caught up in a cycle where we're just treating. And nobody wants to say, actually, we're just going to ring fence this money. Let's just put it into prevention. And let's just see. We know it might not be that we're going to see. And I think we want to see impact very quickly.
Yes, I think that's the challenge we have. And then especially with politics as well, and with the kind of governments that changes maybe every 4 years. Everybody wants to put their mark on stuff, like we were speaking before about the changes that are happening, the restructuring that happens. It's a lot. So we've got a lot to contend with. And so that takes me to my next question. In terms of, what do you see in terms of the work and the advocacy that we need to do as professionals in terms of your role, whether you're as a midwife or even in the work we need to do with maternal health? What can we do? Where do we stand? I know there's one thing that was said, and we're going to end with that about community, but let's even leave the let's, as professionals, what can we say? What can we do?
I mean, I will go back a little bit to kind of my passion and kind of, I would say, what is also currently driving me at the moment is, and maternal health, yes, there's NHS, but there's also the way that mothers and pregnancy is supported in general. So unfortunately, I had a car accident when I was pregnant with my son. I was stationary and I was hit from behind. I sustained trauma to my lower abdomen. And what I didn't know is that on top of the abdominal cramping that I was getting and the fear for losing my son, the seatbelt also misaligned my pelvis. And I didn't know that at the time. So after I went to the hospital, stayed overnight, was monitored, I was getting this really, really bad pain in my lower back on a particular side. And my thinking was, you have a car accident in pregnancy, you leave, at that time it was the solicitor attached to my insurance company to get on with it. Because I was just like, I'm pregnant, this is too much for me, just deal with it, it's the easiest way. Years went by, tears, migraine attacks. not being listened to. Again, this theme comes up again. Even when it comes to solicitors attached to insurance company. It was completely disregarded that I was pregnant when this happened. Had it been a normal person, you could have given them a prognosis. But when somebody is pregnant and they have an accident and they sustain injuries, you should be bringing the right professionals in to make sure that the person is assessed properly so that they get the right support. My whole life was essentially snatched from me because people didn't listen to me. And what we don't know is that the longer you leave a misaligned pelvis, the more it impacts on you. It starts to affect your nerves. So to the point where I was getting migraine attacks. I cried. I said, my pelvis hurts. Can someone please check me? Can you send me to the right professionals? I said, I'm a midwife. I know something's not right. Help me. And I was ignored. Only now, after almost it was maybe 5 years plus, I was left in pain. Years and years and years. Lack of support, I would say, from pretty much everyone, including employers. Not really understanding, even though they see you in pain, you explain, you try your best to still be able to do your job, the job that you love. Having all of those things, just like the mums that we care for and the inequalities, the things that stay with you. So only just in June this year, really, really hard for me to finally be diagnosed with fibromyalgia.
Wow.
Which means you basically have pain everywhere.
Yes.
What started off as very localized pain that could have very easily been rectified if I was listened to. I'm now at a place where it's impacting on my life. So I'm just I'm living out that every day. And I would say that's probably what, again, has driven me. Because, again, it may be in a different field, but, again, it's maternal health inequalities because I was pregnant. On top of my own trauma from childbirth, I'm now seeing, living day to day with the impact of someone not listening to me. Wow. So it's what makes me, what drives me now even more and more. And actually, fibromyalgia is a condition that I think not many people know about. Yeah,
the first time I heard about it was from a relative, actually. Mm-hmm. And this is quite interesting because she went through abuse. Relatives called her that she was always in pain, but they kept on saying that she doesn't want to work, she's lazy, she's this, until she got but before then it's she's always complaining about ill health. So even culturally speaking, we're not supposed to be talking about that. We're sick, we're supposed to be getting on and doing it, but because she had this pain all the time. So that was the first time I heard about it. That was about 5 years ago. So, I can't even pronounce it the way you just pronounced it now. So I hear you. Yes. But it's interesting to hear that because a lot of people, even from our community, might not understand it. No. And it's not something so there was a particular pathway. So you go through a rheumatologist. In my case, I went to a pain consultant. And by the time I was explaining all my sensations, they were just like, this is what it is. It was the first time I'd ever even put two and two together to think the trauma, because often it does happen from trauma, the trauma of the car accident, and being left for years and years in pain has now led to that. And the rheumatologist has obviously now, also said, okay, yes, I agree, this is what it is. Where do we go from here? The advocacy. Yes. The advocacy, I think for me, we need to do more. Yeah. I think it's also about getting our stories as well. Yes. We need to get our communities to trust us more to tell those stories. Yes. And I think for me, that has been because we live in a place whereby people don't, especially from I know that for a fact that if I tell my story, how they're going to see me. If I tell my story, how they're going to look at me. If I tell my story, they're going to shame me. So there's a lot of that going on.
Yeah.
So, and that's why people don't want to take place. I heard you say about taking part in research as well.
Yes.
So we as advocates actually need those stories to make a point that it is. I don't know whether that will be pull the stats together. Maybe that's part of the work that we need to do when we look at what we want to do for 2026.
Yes,
so
yes,
I think,
yes. I think there is a lot to do, but as I think we keep saying, it does start with us as a community. If we've been waiting for a long time for someone to help. But when I think about the power in the community and what we have in Africa, there is a part of that we should have brought with us.
Yes.
Because actually, there is so much that you can do within the community. There's so many professionals in our community.
I think one of the challenges we also have is that there's that division. Everybody's living in silos. There's so much about everybody has their own corner to fight. Everybody's fighting their own corner. They don't even have time. But we've got a job to do about bringing everybody together. That's a job we've got to pull together.
But it is hard because I think also you want to sustain that culture.
Yes.
But you've now come into a culture where it is very every man for himself.
Yes.
So how do you break that down? How do we change the mentality and the mindset and actually make people understand that if you can do things together, it will benefit you, it will benefit your children, it will benefit generations to come. There is so much that we can do for each other.
Yes.
So much knowledge. I don't want to have knowledge and not give it. I'm one of those people that I will tell you, whether you want to listen to me or not, I will tell you what you can do for yourself, what you can do for your child. Because I want our community to prosper in the way that I know that we can.
We can, and we should.
And we should.
And we should encourage that we can do that.
Yeah.
So I think that's where we're going to leave this.
Yes. Yes.
Community. Because we've got community. Community. We need to build that. And if the system sees that we have a community, I think we'll be able to get them to listen more. But it's a journey we're on.
Yes.
And I'm looking forward to working more with you because we've got so much work to do in the years to come. And I'm hoping that we will do that together.
Yes.
I want to say thank you, Buki, for sharing too. This has been wonderful and very eye-opening. And if you've been watching, it's about echoes of our community. And we've been talking about that. We want to build community. It's important for us to do that. And we will do that. So if you have listened, please share, please like, please subscribe. And if you have any thoughts you want to share, please feel free to do that. Write to us, email us, text us. And I'll see you next time on Echoes of Our Community.